wanted to use this opportunity to give a brief summary of what transpired today for approximately 3.5 hours in terms of a CARICOM Ministers of Health emergency meeting. It was a video conference meeting that was called on Friday by the Assistant Secretary General of CARICOM, Dr. Douglas Slater, and his team. And before I go any further, for the benefit of the public, let me explain what that is about. The CARICOM Ministers of Health fall under the umbrella of the quasi-cabinet of CARICOM, referred to shortly as COSAD, which is the Council on Human and Social Development. There are several other quasi-heads, including COFAB, etc., COTED, and so forth. But for purposes of health and education, etc., the head that we operate under is COSAD, C-O-H-S-O-D. Now, the current chairperson of COSAD is the Minister of Health for Antigua and Barbuda, the Honorable Malwin Joseph, who would have chaired this morning's meeting. I should also indicate at this point via reminder that the current prime ministerial head of COSAD is our own Prime Minister, Dr. the Honorable Timothy Harris, who unfortunately could not join us this morning, but nevertheless, his sentiments in terms of what we're dealing would have been ably communicated to our CARICOM colleagues in terms of what we are dealing with here and the methodologies and preparations, etc., plans and actions that are intended to prevent and control and to save lives and to preserve health. So all of that would have been presented. Now, a major portion of this morning's meeting, which would have started at 10, finishing just after 1:30 p.m., would have been an extensive presentation by CARPHA, the Caribbean Public Health Agency. Now, CARPHA would have provided us with several updates within the last 7 or so days, would you say, CMO? Yeah. And just this, in the same way that the coronavirus is dynamic, so too has the CARPHA report system been. So a report that you got from CARPHA on Friday is no longer valid today, because the information is changing. So Dr. Joy St. John, the Executive Director of CARPHA, would have given an extensive outline as it relates to the number of deaths, etc. Dr. Cameron Wilkinson and Dr. Hazel Laws would have augmented what would have been shared with us as ministers this morning, so I need not get into that. However, what I would also indicate is that much in the same way that this afternoon's press conference is multi-sectoral in its approach, so too was the COSAD meeting. Because in addition to hearing from CARPHA, we also had representation by CDEMA, which is the Caribbean overarching head as it relates to disaster management, headquartered in Barbados, and IMPACTS, which, as you may or should know, is the CARICOM region's investigating agency that deals with crime and security, and also PAHO, the Pan American Health Organization, through the offices in Barbados and also Washington, D.C. If I'm not mistaken, I think WHO was also online with us from Geneva, Switzerland. Now, if I could just give you the unofficial version of what I had as the takeaway points from that meeting, the first of which has to do with plans and procedures to handle lab testing. I think because we are basically preparing, if the worst happens, that we would have a large number of samples that would have to be tested to verify diagnoses, that in the first instance, CARPHA is trying to get the cooperation of the regional member states in ensuring that we try to put a cap on the number of tests to not more than 100. It's a similar thing that would have been done, for example, when we had chikungunya. We would have done similar things when we had outbreaks of dengue and yellow fever as well, because there comes a point of redundancy where it doesn't make sense to do the testing any longer, because by then the symptoms will be so clear and recognizable that you can take matters in your own hand at the local level to preserve health and wellness and to get people back on their feet if they're so diagnosed in a positive way. Of course, they would have reinforced the instruction and the preference for restriction of soft landings. By that they mean no non-essential travel to the region by persons originating out of mainland China. We would have also looked, quite interestingly, at the socio-economic implications of the coronavirus issue bearing in mind the experiences that member states through CARICOM would have been frightened over, and what would have obtained in the Middle East, in the Southeast Asia area, etc., when other diseases of the coronavirus family, such as MERS and SARS, would have been evident. So, and of course, the primary area that would concern us in terms of the socioeconomic challenges would be our labor force. Because if it comes down to a point where we have enough debilitating illnesses, it then means that time away from work means lower productivity, and would also translate into a reduction in terms of national competitiveness, since labor is a major factor of production. So these are some of the issues we would be looking at, and of course, all of this would be superimposed on what we already have as a formidable threat, which happens to be the fight against chronic non-communicable diseases, which already is having a deleterious impact on the region's workforce as we speak. We also would have looked at various issues such as the nuances that might exist in certain countries that need to be considered. For example, even though we are part of CARICOM, we still recognize that every CARICOM member state has its own sovereignty. And we cannot have a blanket provision that say, if you do this in St. Kitts and Nevis, this is what you must do in Grenada, in Guyana, and so forth. So, and every situation is different in every member state. And I think, not to put too fine a point on it, AG, if you would concur with me, the point was even raised by the time we adjourned, that every single case that we suspect at our ports of entry must be treated on a case-by-case basis. It actually comes down to that. It can't be a blanket assumption. At the same time, we are also trying to guard against other ills, in addition to the what the CMO referred to as an epidemic of information coming through social media, a lot of it inaccurate, a lot of it meant to instill fear. That at the same time, we guard against other forms of bad intent and fallout, which might come from things like xenophobia. Just because we might have the epicenter of the coronavirus being in Wuhan province, mainland China, central China, it doesn't give us the right as a people of St. Kitts and Nevis or the rest of the CARICOM member states to have people of Chinese origin walking around as if they have a bullseye on them, and that you should treat them as if they have leprosy. That is something that we do not want. And we are seeing some of that emerging in some of the social media posting, in going so far as to boycotting businesses that are owned by Chinese nationals. These are not things that this government would stand behind, and we would seek the indulgence of the public to cease and desist from doing things like that. Not just here, but also in the region. We would have had the benefit of certain video clips from CARICOM, where one man in particular, very strong Trinidadian accent, is blaming coronavirus in Trinidad on five Chinese nationals. Granted, Trinidad is yet to say whether or not they have one case, but he has his own different opinion. So we've seen some of that nonsense out there, which we have to guard against. The high-risk implications in terms of our assessment is something for us to consider, especially now that Dr. Tedros and the rest of his IHR emergency committee would have deemed that it's high risk for us in St. Kitts and Nevis and the rest of the world outside of mainland China. We are also looking towards the support that PAHO would have reinforced this morning in terms of helping member states to identify where there may be gaps in terms of our national readiness. They're asking us to review our systems in concert with NEMA, as well as the Ministry of Health, Ministry of National Security, Immigration, Customs, to see where there might be unforeseen things that we may not have thought of that might pop up as an issue. And then we are eagerly being asked to refer these to PAHO for some support that they can render us in that regard. We also saw coming out of the recommendations from the SEDEMA presentation that there needs to be a development of a model national strategy for disaster management. We would have wished that we had a little more time to get into that subject area. Unfortunately, we didn't, but we have been promised that by the close of business today, all of the presentations that would have been made at the COSAD meeting would be made available to everybody who was online. So that particular presentation from SEDEMA, I know for a fact the Honorable Attorney General, as chair of the Disaster Mitigation Council, has already registered a keen interest in being able to review that document with Mr. Samuel so that we can send back some volleys to SEDIMA to ask them to explain in a more fulsome manner what is their vision behind what they just indicated. In terms of impacts, we are being asked to reinforce the whole issue that legislation as it relates to APIS, which is the Advanced Passenger Information System, that it needs to be enforced over and over. So that is very much a matter for the airline industry as much as it is for the cruise industry, even though we foresee less likely fallout in cruise, but also in terms of immigration. So they are seeking the support of the various national security arms that deal with the movement of people to ensure that the legislation as it relates to APIS is followed strictly to the letter of the law. The public also is being reminded in that meeting again today that they need to rely on only official bona fide sources of information when it comes to getting the word out there, information in terms of the coronavirus, what is being done with your domestic ministries of health in the member states, what is being done at both community-based and institution-based health services, so that everybody is reading from the same hymn sheet, and that we use every possible means of communication, including social media, because it has a lot of good. And when we recognize that we have a very high penetration rate in terms of cellular phones in St. Kitts and Nevis, that is basically an untapped area where we could be using that mobile technology to help get that messaging across. And as I'm saying this, I would like to use this medium to remind the members of the press here, as well as our other stakeholders, that the Federal Ministry of Health does have a Facebook page dealing with health promotion that is maintained every single day, and that we also now have a YouTube channel. So some of the information, including this very press conference, is being streamed through that Facebook page, so that those persons who are not here, who are not in front of a radio or television, who are out in the diaspora, can follow what we are doing right here. So that point I wanted to reinforce. And if we can just move right along, CARFA has also indicated to us today, by the time of the adjournment, that there is a draft communication strategy that will be approved by the CARICOM through the ministers, the Council of Ministers, within the next 3 days. And that communication strategy takes in both regular media as well as social media. We already have in place, which facilitates this process, a national focal point in each of the territories that will help to drive that communications strategy or protocol that should govern how we communicate within the member states. By the time we would have adjourned the official business of the COSAD meeting at around 12:59 p.m., we were then joined at the request of the FCCA, the Florida Caribbean Cruise Association, to have an audience with the Council of Ministers. They used this opportunity, led by their chief spokesperson, Michelle Page, and also representation from the Cruise Line Industry Association. There's several of them who are online with us, especially representation from Carnival and Royal Caribbean, in terms of reinforcing to us their continued goodwill and good faith with the member states within CARICOM with active cruise industries, and for countries like us who would have recently heavily invested yet again in the cruise sector, the tourism plant as it relates to the second pier. Other territories such as Antigua, who is about to embark into the construction of a new pier, that they wanted us to be assured that every precaution that is possible they are taking. For example, and if I can quote from Michelle Page and the Chief Medical Officer for Carnival Cruise Lines directly, for example, they indicate that they're denying boarding to anyone who has been to China. And for persons who have been to Hong Kong or Macau, they are insisting on health checks. And if they notice that these persons would have recovered recently from any flu-like illnesses, they are refusing their business. When it relates to deployment of their crew, who are originally from China, they have indicated to us that they have stopped every single crew member of Chinese origin from being part of any cruise tours from now on until further notice from the WHO. Some might look at it and say that it's draconian. But then I don't want to second guess the FCCA. They operate all over the world, and they must have thought long and hard about this decision before they put it in place. What that also does is that it gives to us who are member states reliant on business from the FCCA a measure of comfort, especially as it relates to those of us who have already issued travel advisories, that what we have done thus far to protect our people and our borders should not be construed as draconian. So there is no fear in that in terms of the FCCA being under threat by what we have done nationally or regionally, to the point where they figure, let us retaliate and pull out our cruise vessels. That is not the case, at least not what they are telling us from today's meeting. We are also seeing that they believe that they will not have any person who has been or who they know to have any linkages to mainland China to be on any of their ships. They're expecting full disclosure from these individuals. They're reassuring us that regular disinfecting of the ships will be stepped up. Dr. Wilkinson made reference to some of that, even by simple things like sanitization of doorknobs, railings, and so forth on the ship, even the knobs that you touch for the elevator and so forth. They are looking at these matters as areas where they can do some interruption in terms of contact points as it relates to live viruses. What is not clear is how long these viruses can remain alive. What was mentioned, however, today is that certain samples that would have been taken in China have been able to survive for a couple hours based on what the Chinese authorities are saying outside in the open, but there is still no determination as to how long is the life cycle of that virus outside of an actual host. In terms of suspected cases, they guarantee us that they will be isolating them on board ship. Persons with the flu will be isolated within their own room, and of course the Maritime Declaration on Health will be filled out accordingly. They're promising us that we would have that declaration no later than 24 hours before the ship arrives. On that note, we also would have raised the issue of the Aida Perla, which was denied disembarking in St. Lucia over the weekend because of the fact that they would have surpassed the 2% threshold when it came to people who had respiratory ailments. I should also state at this point that the St. Kitts Tourism Authority, as a way of comforting our people, especially those who are reliant on the cruise business, that they would have issued within the last 24 hours a declaration insisting that the Aida Perla is not making any port of call here on St. Kitts and Nevis. However, they also indicated to us that in the next week or two, they would have two other members of the AIDA line visiting St. Kitts and Nevis. I think one is the AIDA Luna, and I cannot remember the name of the other one, but for the members of the media, you can just as easily call the Tourism Authority to verify that, or take a look on the online itinerary for the cruise industry for the next couple of weeks based on arrivals. Now, one of the issues that would have come out of the meeting as well, especially with the interjection of Michelle Page, is the other measures they're taking on board the ship in terms of personal protective equipment. That would have also come out in the regular meeting for COSAD today. The point was made that there is no sense in terms of having a run on personal protective equipment because so much about the epidemiology of the coronavirus is unknown that we are not certain. But what CAFA is insisting is that if you're going to buy a mask, if the time ever comes for that, it must be the N95 mask at least. So that also would have come out in that discussion. There's a point that I wanted to raise, however, which I found was noteworthy, and that was towards the end of the presentation from CAFA, and it is to inform the public here in St. Kitts and Nevis and the wider CARICOM member states that at present, some 157,000 cases are under investigation by the Chinese authorities. And basically, even though there might be a run on the purchase of personal protective equipment, ironically, China is the world's leader in terms of manufacturing those types of equipment, and currently they're running in short supply. So essentially, that is what I would want to share with you.